Myth: snoring is normal. Fact: snoring is not always normal. Occasional, soft snoring is okay. But regular loud snoring can signal obstructive sleep apnea, OSA. In OSA, the airway collapses during sleep. Breathing stops again and again, sometimes hundreds of times a night. Poor quality sleep, extreme daytime tiredness, morning headaches, poor memory and concentration, irritability and decreased work performance are among few symptoms. OSA can also cause high blood pressure, diabetes, heart disease and stroke, higher risk of accidents while driving. So if you have gasping or choking in sleep, daytime sleepiness or dozing while watching TV or driving, a sleep study can confirm OSA. Treatment: weight loss, using special devices like CPAP and mouth appliances. Treat nasal blockage, avoid alcohol at night, and sleep on your side. Snoring is a warning sign. Get evaluated and treated. Better sleep equals better life.